Hello everyone, welcome to our YouTube channels and thank you for watching this video with us. Today we're going to learn what is the basic knowledge about PCOS from Nurse Grace.
Hi, I'm Grace.
I actually Google search about the rate of PCOS in Google. According to WHO, the World Health Organization, there are stated that approximately about 116 million, which means around 3.4%, is affected PCOS globally. So the reason we are having this video is to educate and then to create awareness about PCOS, and because most of my friends around me, they do not know they have PCOS until they're planning to conceive. So Nurse Grace, can you share with us what is the cause of PCOS and what is it about it?
Okay, so PCOS is a condition that affects how a woman's ovaries work, or they have a very long periods, which is called irregular period. And also they're having too much of male hormone, which is called androgen. Because some of the patients, they don't know what is the cause, so usually the cause is unknown, okay? But it's related with the abnormal hormones level. So usually for this PCOS patient, they have this insulin resistance, means that the pancreas can't control the blood sugar well. So you see most of the PCOS patients, they have this obesity and also they have these higher androgen levels.
Okay, so with this explanation just now, so is it inheritable from the parents or is it born disease that there's no cure for it?
Okay, PCOS sometimes runs in families. If you have any relatives such as your mother, your sister or aunt, they have PCOS, the risk of you developing it is very often increased. Okay, so usually if you ask me, PCOS actually is a syndrome, it's not a disease or illness. Okay, so we can treat PCOS. So there are different treatments that we can treat, such as lifestyle. You see most of the PCOS patients, they're having this weight gain. So lifestyle is very important, okay? So like weight loss is very important for them. So usually we ask the patient to diet, exercise, they can have gym. So in diet plans wise, they need to take plenty of water, okay? So instead of white rice, they can change into brown rice, okay? So the other treatment is medication. So as I mentioned just now, PCOS lead to irregular period. So usually the doctor will prescribe some medication to regulate their period. And some of the patients, they might ask, can I conceive myself after they treat the irregular period? So sometimes doctor, he will prescribe some ovulation medicine for them, okay? So they will give them try to conceive. Let's say this medication stubborn for them, okay, can't work for them, so the last choice will be IVF treatment. So IVF treatment will be the ovaries are collected and combined with sperm into the laboratory.
How are we going to know when the person is having PCOS? So it must have to wait until the patient's period or to get to know when they are doing ultrasound or operation?
Okay, so PCOS, how to confirm PCOS? There are few types. So the main one will be ultrasound, okay? So this test is used to look at the size of the ovaries, okay, and see if they have any cysts or not, okay. And also you can check, okay, you can look at the thickness of the lining of the uterus, which is called endometrium. The other test will be blood test. That is to check, to look for the level of your male hormone androgen. Actually, there are few symptoms for PCOS. Okay, the main one will be irregular period. Okay, and then you can see also for PCOS patients, they have this excess body hair. Okay, because they have this male hormone high,
You mean hair? Right?
Yeah, the hair, especially their chest, their stomachs, and definitely is weight gain, obesity, and then they have this a lot of acne and oily skin, and then last but not least is infertility. Means that infertility, they can't conceive themselves.
So for those who are watching right now, if you have mentioned the symptoms above, do consult your gynecology. So because I heard a lot about the complications about heart attack and the diabetics, do we have any complications for PCOS?
Oh yeah, usually PCOS, what are the complications of? So the first one will be diabetes mellitus. So as I mentioned, usually for these PCOS patients, they have this weight gain, okay, and because of the insulin resistance, because the pancreas can't use the insulin well, okay, then slowly they will lead to hypertension, okay, and then cardiovascular disease such as heart disease, heart attack, and stroke, and then slowly will be have depression. Why they have depression? Because you see, PCOS, they are weight gain, so they can't lose weight, and then they can't conceive their infertility. So usually these patients, they have this depression. And then the last one will be sleep apnea. Sleep apnea means, overweight patients, sometimes when you sleep, the tongue will fall back. So when they sleep time, their breathing, they will stop in a few seconds, and then they will start back to breathe. So this is sleep apnea for PCOS patient. Yeah. So very important to lose weight for PCOS patient.
So just now, the symptoms that you mentioned about you can't conceive yourself means infertility. So what can be done to increase the chances to get pregnancy for PCOS patients?
Okay, there are a few ways to improve the chances of getting pregnant. The first one, obviously, diet because of obesity, okay, exercise, and then medication. Let's say the medication can't help, the last choice will be IVF treatment.
So that is for those who are not pregnant. So what about those who are already pregnant, and what is the impact for the stage of pregnancy?
Okay, for PCOS patients who are already pregnant, they are high risk. Okay, so the high risk of miscarriage due to early loss of pregnancy, okay, and diabetes, gestational of diabetes, okay, preeclampsia means that most of the patients who have PCOS, they have preeclampsia because they have high BP during their pregnancy, and then definitely the baby will have preterm, okay, and then the last one will be definitely have to be Caesar because of the big baby, because of insulin, diabetes baby, yeah.
I see. So the recommended way to get pregnant for PCOS patients is to get IVF treatment?
Okay, IVF is an excellent option when PCOS fertility medication fail. Okay, with IVF, there are higher chances of getting pregnant.
I see. Okay, so lastly, will PCOS go away when the patient in a stage of menopause?
Okay, PCOS, it is now evident that PCOS does not disappear as women get into menopause.
Wow, it's a good session with Nurse Grace, and I believe that we already covered for all ages, and I hope that these videos can bring you and your families or your friends a heads up about PCOS, so to get understand more on your body conditions. So thank you for staying this far with us, and see you next time. Bye.